There hasn't been a toxin to which vitamin C has been introduced that it hasn't neutralized. None, zero, nada. I have my email address at the end of the lecture. If you can find one, if you can find any sort of valid study that shows vitamin C can't neutralize a toxin, I'll want to see it. I'll frame it. All the different venoms. You know what's really toxic? Almost as toxic as a venom? An antivenom. The antivenom, the anti-serum that they give to treat snake bites. Okay? Not necessary. Acutely poisoned patient who felt he was dying, Klenner wrote 12 grams of vitamin C was quickly pulled into a 50 cc syringe and with a 20 gauge needle was given intravenously as fast as the plunger could be pushed. Even before the injection was completed, the patient exclaimed, "Thank God." When the poison is circulating in the bloodstream, that's how quickly vitamin C acts. Okay? And when you're giving it this way, it's maximal concentration, 500 milligram per cc. If you're never comfortable with using vitamin C as a monotherapy, use all the other standard therapies. That's okay. And if you use a high enough dose of vitamin C, you'll cure the condition and you'll neutralize the toxicity of the mainstream therapy, the antitoxin, the snake bite toxin, antitoxin, you name it. Also, on some of the insect bites and other toxic bite syndromes that he faced, I think it's very important to understand the rapidity with which not only toxins can have their toxic effect, but vitamin C and other antioxidants can have their antitoxic effect. If you look through his articles, you'll see some dramatic occasions where I think in one case it was a brown recluse spider. This patient came in having been recently bit, comes into Klenner's office, and I might add, Klenner had a policy in his office to start the vitamin C and then take the history. So this patient lays down on his table and he says, "You know, Doc, I think I'm going out." He took the blood pressure. It was like 80 or 75 over 0. Well, Klenner did something that most people would think unfathomable. And believe it or not, a lot of doctors today, especially quote-unquote mainstream, would consider what Klenner did to be uniformly fatal to anybody that it was done to. But I can tell you that's simply not true because I've done it many times myself and to myself. And what Klenner did was he started a butterfly in the patient's arm, and then he took the highest concentration of vitamin C, the way it comes today in the ampules or vials. I think it's 500 milligrams per cc. And he gave something on the order of 7 to 10 grams, IV push, and in Klenner's own words, as rapidly as a 20 gauge needle will allow. That's the rate. So don't ask me how many drops per minute or drops per second. You just push on the syringe until sweat pops out on your forehead, and that's the rate that Klenner used. And before the syringe was all the way down, the patient was coming out of it. And when you're getting high enough doses of vitamin C in the patient, this is how quickly they respond from snake bite and other circumstances. When I see news shows, I saw one last night or the night before, this poor little girl who's just come out of a long-standing coma from her West Nile virus. I've cured 2 cases of West Nile virus, the only 2 cases that have come to me.
Early in 1930, an American, Dr. Klenner, did much research on the use of vitamin C on humans. In turn, a Californian vet, Dr. Wendell Belfield, carried on the good work with impressive results on all sorts of dog ailments that are generally considered incurable or fatal. Today, in USA, There are now a significant number of vets practicing alternative medicine such as this. After studying the literature, I decided that I really had nothing to lose trying vitamin C on my own farm animals. The first one was a pony, almost moribund, whose blood was later diagnosed as having the largest amount of tiger snake venom the vet had ever seen in an animal. Within 24 hours of being unable to move, and also having considerable difficulty in breathing due to pneumonia, the pony was grazing happily in its owner's garden, apparently quite healthy. I only had one 30 ml bottle of vitamin C, half of what I would have liked, so I put half of the bottle into each side of the neck by intramuscular injection. After that we treated sundry dogs, 2 cats and several goats including a stud buck. All recovered. A very valuable alpaca which was being watched by its owner from her kitchen window went down to the dam to examine something. The owners, horrified, watched a large snake rise up and strike it on the nose, the worst place, and thanked her lucky stars the vitamin C was in the fridge, not still on the shopping list. Rushing out with only 15 ml in the syringe, she injected the alpaca before any symptoms arose. The snake had looked like a brown or a tiger. The result, happy ending. The great advantage of vitamin C is that anaphylaxis does not occur and the variety of snake does not matter. Vitamin C is cheap, easy to store, and taking it on a hunting trip is no problem. All you need is a 20 ml syringe, some largish needles, say no 18, and the bottle of vitamin C. It can all be carried in a small wallet on one's belt. In between times it should be kept in the fridge. Although the stuff can be carried in summer without deteriorating, I suggest to hunters that they get a fresh supply each spring just to be on the safe side. After much reading of printouts of Belfield's and other literature, many supplied by Dr. Glenn Diekman, a retired pathologist who lives near Melbourne, I have tried vitamin C in many situations: a dog in a tick coma, spider bites, dogs with parvo, tetanus following a terrible injury from a car, and in cases of shock, all with unfailing success. Vitamin C can be used as crushed tablets or powder straight into the mouth in cases of sickness. From my own experience, rubbing the powder into the redback spider bite took the pain, which is incredible, out within seconds. I followed it up with 10 grams by mouth. The spread of the poison in my arm stopped and I was able to resume work within a few minutes. The first goat I treated with vitamin C was given a teaspoon of ascorbic acid powder, about 5 grams, every half hour for 2 hours. Like the alpaca, he was bitten right on the nose, as I later found out. He recovered perfectly well. That was in the days before the injectable supplies were available. 50 ml bottles of vitamin C can be obtained from some chemists, most fodder or pet stores. Make sure the brand is 2 ml per gram and not 4, otherwise you need twice as much at twice the cost. I mentioned the size of the needles as 18 or thereabouts because the stuff can be slightly glutinous and speed is generally all important on the occasions when it is needed. Snake venom affects the nervous system, which slows down until natural functions cease and death occurs. A painful way to die. It can cause instant death, but this is most unusual and I have never seen it. When a dog has been bitten, its eyes will soon appear to look all black. That is, the pupils have relaxed and dilated. Since snake bite can, and usually does, occur unwitnessed, if your dog slows down and becomes lethargic or distressed, do look at the eyes at once, and even if they do not show much sign, get on with the injection. If by chance the fang marks are detected, it is usually damp around the bite. Rub in Vit C, even a chewed up tablet will work. But do not waste time looking for the marks. They often only show up a few days later when the hair falls away around them. Dogs of 30 to 50 kilograms will require about 10 to 15 ml by intramuscular injection in the side of the neck. I was taught by the teaching vet at the veterinary college to avoid doing injections in the back legs because it is too easy to damage vital nerves there. 3/4 to 1 centimeter penetration is needed, and, if in doubt, get it under the skin anyway. You can repeat the treatment without risk. Vitamin C overdose results in nothing worse than diarrhea, and anaphylaxis cannot occur. However, when the dog is really sick, it will allow you to do the injecting, which can sting in small animals, without objecting. If it starts to make a fuss, you know that it is feeling much better, and the subsequent doses should be given as powder in the mouth. It is a good idea to give 2 or 3 backups just to make sure all the venom has been detoxified. Pat Coleby. Pat is a farmer who writes books on animal care and lectures widely on the subject as well as being a consultant, originally published in the Australian Shooters Journal.